Our planet is changing at an alarming rate. The evidence is everywhere. Glaciers, once permanent fixtures on the Earth's surface, are melting at an unprecedented pace. This melting ice contributes to rising sea levels, threatening coastal communities and ecosystems. The oceans themselves are warming, leading to more frequent and intense storms. Hurricanes, once rare occurrences, are becoming more commonplace. These storms bring with them devastating winds, torrential rainfall, and catastrophic flooding. The effects of climate change are not limited to water. Rising temperatures are also contributing to more frequent and intense heat waves. These heat waves can be deadly, particularly for the elderly and those with underlying health conditions. Wildfires, fueled by dry conditions and high temperatures, are raging across the globe, destroying homes, displacing communities, and releasing harmful pollutants into the atmosphere. These changes are not isolated incidents, they are interconnected consequences of a warming planet. The scientific consensus is clear: human activity, particularly the burning of fossil fuels, is the primary driver of climate change. The release of greenhouse gases such as carbon dioxide into the atmosphere is trapping heat and causing the planet to warm. Despite the overwhelming evidence, there is still resistance to acknowledging the severity of the problem and taking meaningful action. This denial and inaction only serve to exacerbate the issue, pushing us closer to a point of no return. The time for complacency is long gone. We are living in a climate emergency, and the consequences of inaction are dire. We must act now to reduce our reliance on fossil fuels, transition to cleaner sources of energy, and implement sustainable practices. The future of our planet and the health of generations to come depends on it. The impacts of climate change extend far beyond melting glaciers and rising sea levels. They strike at the very heart of human health, threatening to unravel decades of progress in global well-being. As temperatures soar and natural disasters become more frequent, we face a rising tide of health concerns that demand our immediate attention. One of the most immediate and alarming consequences is the increase in heat-related illnesses and deaths. Heat waves, once a seasonal annoyance, are becoming more intense and prolonged, pushing the limits of human tolerance. The elderly, the very young, and those with pre-existing health conditions are particularly vulnerable to heat stroke, dehydration, and other heat-related complications. As temperatures continue to rise, we can expect to see a surge in heat-related illnesses and deaths, overwhelming healthcare systems and claiming countless lives. But the health impacts of climate change extend far beyond the immediate dangers of extreme heat. The disruption of ecosystems, driven by changing weather patterns and rising temperatures, threatens our food security. Droughts, floods, and extreme weather events can decimate crops, leading to food shortages and malnutrition. Rising sea levels can contaminate freshwater sources with salt water, jeopardizing access to safe drinking water for millions. The consequences of these environmental shifts are dire. Malnutrition weakens the immune system, making individuals more susceptible to infectious diseases. Lack of access to safe water can lead to outbreaks of waterborne illnesses like cholera and dysentery. These health challenges disproportionately impact the most vulnerable populations, exacerbating existing health inequities and creating a vicious cycle of poverty and disease. The evidence is irrefutable. Human activity, particularly the relentless burning of fossil fuels, is the driving force behind the climate crisis and its devastating health impacts. The responsibility for mitigating this crisis rests squarely on the shoulders of the world's largest polluters, those nations whose economies have flourished at the expense of our planet's health. The United States, China, and India stand as the top 3 emitters of greenhouse gases, accounting for a staggering portion of global emissions. These nations, with their vast industrial complexes, sprawling cities, and insatiable appetite for energy, bear a moral obligation to lead the charge in climate action. Their historical and ongoing contributions to the problem demand immediate and significant reductions in emissions. However, true accountability extends beyond mere emission reductions. It requires acknowledging the disproportionate impact of climate change on developing nations, those least responsible for the problem, yet most vulnerable to its consequences. The developed world has a moral imperative to provide financial and technological assistance to these nations, enabling them to adapt to a changing climate and pursue sustainable development pathways. Holding polluters accountable demands a multifaceted approach. Governments must implement stringent regulations on emissions, invest in renewable energy sources, and promote sustainable practices across all sectors of the economy. Corporations, particularly those in the fossil fuel industry, must be held responsible for their role in fueling the climate crisis and be compelled to transition to cleaner, more sustainable business models. In the face of the escalating climate crisis, bioethicists have a crucial role to play, not just as detached observers, but as active participants in shaping a just and sustainable future. Their expertise in navigating complex ethical dilemmas, particularly those arising at the intersection of human health, environmental integrity, and social justice, is more critical than ever. Bioethicists must leverage their platform to educate and engage the public, transforming scientific data into compelling narratives that resonate with a wider audience. They must bridge the gap between the scientific community and the public, clearly articulating the health impacts of climate change and dismantling the misinformation campaigns propagated by those seeking to maintain the status quo. Moreover, bioethicists must actively engage with policymakers, advocating for policies that prioritize public health and environmental sustainability. They must push for stricter regulations on emissions, increased investment in renewable energy, and the development of climate-resilient healthcare systems. Their expertise can inform the creation of ethical frameworks for climate action, ensuring that the burdens and benefits of mitigation and adaptation strategies are distributed equitably. The time for passive observation is over. Bioethicists must step into the fray, using their voices to amplify the urgency of the climate crisis and their expertise to guide the development of just and sustainable solutions. The health of our planet and the well-being of generations to come hinges on our collective action.